Welcome back to another episode of Pelvic Confessions. I am Dr. Carrie Howe, joined by my co-host, Dr. Jean Sharakabrad.
Hey, Care. So on this episode or on this show, we have conversations pertaining to women's health and really having the conversations that women should have but don't often have.
Yep, each week we present our topics as confessions women have told me regarding their pelvic health. We always omit any type of detail for sake of privacy of my ladies.
So if you've been following along, we're kind of getting into little mini themes, not necessarily on purpose. It's just the conversations happen to come around. And this is kind of really the final or end conversation on the progression. So last two episodes, we talked about pregnancy and we talked about getting pregnant, initially being excited, then going, now what? And then you have the baby. And it's really very similar question.
Now what?
Now what?
Right.
Just from a very different angle.
Different phases.
So now we're kind of getting into another phase of that. And this confession comes from really a place of healing and taking the next phase forward.
Yeah.
In one of our favorite phases, which is movement and exercise and activity. So let's get into it. This confession is I gave birth. I'm progressed, I'm starting to feel better, I'm ready to take the next step in working out, but I don't really know where to start or what to do, what is safe, what is not safe.
Yeah.
So that's the confession is, I'm ready, but now what? And so there's a lot of avenues to go into it, but I think this is such an amazing opportunity for women to see pelvic physical therapy because it straddles both doors, right? It's the let's take a look from a medical standpoint, from a tissue standpoint, but also let's really talk about dosage and what the tissues can handle. So how do you first approach a lady that comes to you and is kind of excited to work out?
Well, we always talk, and it's all about the nuances in terms of what we do, right?
Yeah.
And so it depends certainly if we're dealing with a woman who is asymptomatic versus somebody who is symptomatic. And so just to even start that scan out initially, postpartum, maybe we're around that 6-week mark. Again, we talked last video, it's relatively arbitrary, but if they've been cleared from their physician and they're ready to get back into their exercise routine, I first want to know, are they having any symptoms? And so symptoms can include urinary leaking. Symptoms can include vaginal pressure and heaviness. It can include diastasis recti, any coning or doming, any pelvic pain, any pain with intercourse since returning. So we really want to get a good idea of where their new baseline, so to speak, is postpartum before we then progress.
Yeah. So we've often kind of talked about this as being the fourth trimester, right? Which I mean it makes sense, not necessarily coined by us, but it's a great way to describe this next phase. And I'm glad you mentioned symptoms because postpartum isn't a condition, right? It's not like prolapse or something else we've talked about, but it does contain a lot of changes to the body, and these conditions happen at different times at different intensities. What are some of the common transitions or changes do you see with women's body as they start the fourth trimester that might have not necessarily been there pre-pregnancy?
Yeah, I mean, obviously the list of symptoms that I just chatted about, we're always scanning any type of urinary, any bowel, any sexual functioning symptoms, but then also really common to see symptoms pop up in terms of abdominals, right? A lot of women report abdominal weakness. They can't reconnect to this area as easily because belly has been stretched for a long period of time. So that's a really common one. Fatigue, which it's not as pelvic floor symptom, but it does play a role into their overall health and well-being and how rested they are versus how recovered they can be.
What is I know one thing I've commonly heard, and I think once getting to exercise, like there's this mindset or this idea that I want to bounce back, right? That there's this connection to how the body was.
Yeah.
And it does rebound in a lot of ways, but I know we always frame it as it's not so much about bouncing back, it's about looking forward. It's about figuring out what your body is now, because it doesn't necessarily mean it's going to be the way it was before. And one of those changes, because pregnancy is unique in a lot of ways, but one of the biggest ones is the change that the not just the pelvis, but the abdominals and the trunk has to go through.
Sure.
So diastasis, you mentioned, is one of the big ones, and it's not just the muscles separating or the tissue separating, it's the feeling the body has.
The sensation.
The sensation of that disconnect.
That loss of instability, not feeling like they can control their trunk. When we're talking about postpartum return to readiness for exercise, we really want to take into account the tissues that have been deconditioned the most throughout pregnancy.
Yeah.
And so we're looking at abdominal wall, we're looking at pelvic floor, your glute muscles, your hip rotators and stabilizing muscles, your glute max. Like, those are the muscles that really took the most beating, so to speak, during pregnancy. And so a large part of that return to exercise readiness is going to be surrounded those areas, right? Your trunk, your pelvic girdle. And so a large portion of getting back into exercise is starting out with some type of strength-based approach for those regions. And
I'm guessing it doesn't take much, right? Because I'm sure it's very daunting for women, because like you said, there's fatigue, there's taking care of baby, there's figuring out this new dynamic of the body, there's still hormones flowing through. So it doesn't have to be complicated to get started, right?
Yeah, no, it doesn't. Unfortunately, there's not a whole lot of research in this field, though, particularly in terms of reintroducing exercise postpartum. We have a lot in the musculoskeletal world, but not a whole lot. Now, in 2019, there was some postpartum guidelines for return to run readiness, and those guidelines are actually recommending around 12 weeks, waiting till 12 weeks for return to run specifically. Again, that doesn't mean for those first 12 weeks you're not doing anything, but when we're looking into higher impact, higher level demands, jumping, running, those type of activities, we want to make sure we have a good base foundation, again, with that strength training before we're then bridging that gap into higher impact activities.
Yeah. And you mentioned nuance in the beginning. Nuance becomes then really important, because when there's not a ton of research in a category, you have to go by what's in front of you. Like, you still pull in tissue physiology and what we know from just how tissues adapt. But having the person in front of you makes a lot of sense. And this is like, to tie it all back together, if you're going back to exercise, especially in that 4th trimester, pelvic PT makes a ton of sense, because you can create that baseline objective marker for women to go, here's where you are now, and here's how we project from that and move forward. So what are some of the things you do when you see a lady that comes into you that says, hey, I want to start exercising? What does the assessment look like, and how do you progress?
Well, again, it
depends.
I know. That's always my answer. I hate saying that, but really it does, right? Let's take
nuance.
In the case.
Like, it has to depend.
Sure. Let's take, given the case that a woman is relatively asymptomatic, right? And so that first initial assessment is going to be scanning out externally the abdominals, the glute strength, and then we may also do an internal pelvic exam to see how pelvic floor is functioning at that time. But then progression can look like even just starting off with body weight exercises. It's not uncommon for me to prescribe somebody to, like, hey, let's hold your baby and let's accumulate 30 squats with your baby throughout your day. And 30 bridges with the baby on your lap, and 30 abdominal focused exercises, and starting just really small dose, body weight, maybe a little extra resistance to start moving and start loading the tissues that we want. From there, we can then progress into something a bit more structured, more weight, more load. Yeah. But that would kind of be first steps.
I'm glad you said abdominal, not core.
I know. I'm really. Yeah. I don't think I said core one time in this video specifically for you.
Well done. Well done. Yes, nuance, and it depends. Vaginal birth, C-section depends, right?
Yes.
Of the focus.
Absolutely.
Level of diastasis depends.
Pre-level of function, right? Like that's a really big one.
Yeah. Goals, type of exercise, training.
So much.
All that makes sense. So as, let's say, that baseline gets established, is the lady or is your patient done? Or is this something that, let's say, they get back to structured exercise in CrossFit or a gym or even at home following videos? Is pelvic PT something that they can check in every month or so? Because the time frame is not just, hey, you're done in 6 or 8 weeks or this initial evaluation. It's different.
Again, we have a really unique setup at Restore that we are located within a fitness facility.
Right.
And so I am able to do that for my patients. And then also just having kind of a strength and conditioning background myself to be able to help and assist and facilitate, yes. We do a lot with the gym Recharge with our ladies in terms of checking in on pelvic floor and making sure that they can return to their exercise without leaking.
Yeah, the big thing I've seen over the years is that there's so much new that there's always a shifting timeline of feeling that as soon as they feel a little bit more comfortable and confident, there's another change that happens, right? Because that postpartum period is so variable and so constantly shifting that 4 weeks might go by and she goes, I feel great, I'm feeling good. Then the baby gets heavier, then sleep changes, hormones change, and then everything feels different again.
Yeah.
And I think it's daunting, and it's sometimes it just drains that motivation when they don't have somebody that they can just call or check in with and go,
Sure.
what the heck's going on? How do you help with that? And I feel like that's such a big thing that you often help with.
Yeah. I like to always say, like, your pelvic floor, and given this postpartum time period too, things constantly are in fluctuation. And so even when we're talking about rehabbing postpartum, you might get to a point where you're feeling pretty good, but then there's also a possibility of symptoms kind of popping back up when we're maybe loading up or doing something a little bit higher demand. And it can be a little discouraging, but I think that my clients tend to feel a little peace of mind when they can get back in and we can reassess and evaluate and make sure that they are indeed on their way toward their goals, and just kind of going through those speed bumps together.
Agreed. I think one of the biggest things is in a time when there's so many unknowns and so much out of control, I think having you in their corner gives them a sense of control,
Sure.
a sense of process and consistency, that if you are dealing with if you're in that fourth trimester or you're a new mom, a lot of this probably resonates and hits home. So it's always great to have a team in your corner, and pelvic PT certainly makes a ton of sense. So any closing thoughts? I think we covered a lot for a pretty big topic.
Yeah.
It's hard to go into great detail and specifics. So if we kind of walked around what you're going on with, probably most of it still makes sense and resonates. But if you're around Ellicott City in the Howard County area, or even if you're just anywhere in Maryland and you're watching this, you can head over to restorepelvicpt.com. If you're close by, you can schedule a visit and actually come see Dr. Carey, but you can also do digital appointments now in Maryland. So we're taking new patients via digital, and you can sign up right on the website. That's convenient for you. Follow along on Instagram and soon to be on YouTube as well, to Pelvic Confessions from Restore. Again, with Dr. Carey, I'm Gene Chiracabrad, and we'll catch you again on the next episode of Pelvic Confessions. Cheers!
Woo!